Welcome to Golden Isles TV. Today we are talking about cardiopulmonary rehabilitation. Stay tuned as we talk to exercise physiologists right here at Southeast Georgia Health System. It's all coming up next right here on Golden Isles TV. Hi, and welcome back to Golden Isles TV. I'm your host, Avery Brooks. We are here with exercise physiologist Abby McCrae and Brian LaBudde. How are you today?
Doing good, thanks.
Good. Thank you so much for being here. This is a great facility. So many great exercise pieces of equipment, and we're going to talk all about that today. Can you all explain to me exactly what is cardiopulmonary rehabilitation?
Well, our department here is called Cardiopulmonary Rehabilitation, and that's because we have both cardiac and pulmonary rehab. And those programs consist of exercise, education, and support for people who have heart or lung conditions.
Okay, perfect. And how is, that's a kind of a unique type of therapy, how is it different from just basic physical therapy?
Well, pulmonary, cardiac, and physical therapy all use exercise. But the treatment of heart and lung disease requires a more holistic approach. So besides having medically prescribed and supervised exercise, we also do education on nutrition, medical aspects of the disease, and also different lifestyle choices.
Brian, tell me, a person actually may be prescribed these two rehabilitations. What might lead, like an underlying cause, what might lead someone to be prescribed for cardiac or pulmonary rehab?
Well, there are a number of different heart conditions or procedures that may lead to being prescribed cardiac rehab. So if someone has a stent put in their heart, or if they've had a heart attack within the past year, bypass surgery, if they've had a heart valve that's been repaired or replaced, if they have regular chest pain or heart failure. And then for pulmonary rehabilitation, people who've been diagnosed with moderate to severe COPD or chronic obstructive pulmonary disease. So those would be the qualifying factors.
Right. So Abby, are we seeing an increase in some of these cardiac patients, pulmonary patients that are being prescribed rehab?
So we're definitely seeing an increase in the amount of people with cardiovascular disease. It's the #1 leading cause of death. However, only about 20% of the people that qualify for cardiac rehab are actually being referred to a cardiac rehab program.
Wow. Why is that, Brian?
Well, a lot of times patients don't know what cardiac rehab or pulmonary rehab actually is. And a lot of them also don't think that, or they don't know how it might help them. So quite often we may have patients who will tell us, well, I don't need a cane to walk, or I don't need a walker, and I play golf several times a week, so why do I need to go to rehabilitation?
Right.
But of course, golf actually is not the type of exercise that's going to prevent heart disease or even help to treat it. In fact, you may have heard of the show The Biggest Loser. And actually one of the hosts on there, an actually exercise trainer, had a heart attack a couple of years ago at the age of 52. And he went through a complete cardiac rehab program, even though he was an avid exerciser. So he was actually able to benefit from cardiac rehab.
That's so interesting. You just don't know.
Right. So we try to tailor our program to what our patients need in order to help improve the health of their heart.
Okay.
So some people may have difficulty walking. Other people may be interested in trying to do a 5K run.
Okay. So Abby, tell me about what a typical rehab session might look like.
Okay. Typically a patient comes in and we check them in and make sure their vital signs like their blood pressure and heart rate are good. Then they typically progress to a warm-up period, and we utilize about 2 to 3 machines per patient. And then we incorporate a cool down and stretching period and check their vital signs again.
Great. So is that all done right here in this room?
Yes, it is. So you can see behind us are the different type of equipment that we use for our patients.
Excellent.
And then usually once a week after the exercise is when we do our education for about 20 minutes.
Great. So you're incorporating education, information, and exercise all at the same time.
Yes.
So Brian, you were talking about education. Elaborate a little bit about the education that goes on with each session.
Well, we try to help our patients understand their heart or lung condition. We also help them to understand how to take their medications appropriately, what their medications do and why they're taking them. Also, we help them to adapt a heart-healthy eating pattern. We teach them about exercise and how to exercise safely with a heart or lung condition. We also have a dietitian as part of our program, and our patients can have a one-on-one consultation with their dietitian.
Great. So it's really all-encompassing. It's not just one thing or one joint or one muscle. It's everything.
Correct.
So Abby, you mentioned before when a patient comes in, they're actually monitored before and then after the exercise. However, they're also monitored during the rehab session. Can you tell me about that?
Yes, so when a patient comes in, they actually have to wear a heart monitor during exercise. So we monitor their vital signs, including their blood pressure and their oxygen saturation before exercise begins, and we also check them while they're exercising to make sure that they're exercising at a safe range for them.
Perfect. It's good to know.
Monitoring also allows us to set their exercise level at the most beneficial level for them.
Okay, perfect. And each patient is different, right? So
Right.
it's really a customized plan for each one.
Exactly.
Exactly.
Brian, you were saying that individualized care and also each patient is different. These are prescribed sessions that might be prescribed by a physician. Can you tell me about like how long the duration of the prescription might be? Is it several times a week? Is it for 6 weeks? Tell me about that.
The typical cardiac and pulmonary program run 36 sessions.
Okay.
There is a dose response though to the rehab. So the more rehab that you do, the more positive results that you'll have. So for instance, those people who attend 36 sessions of cardiac rehab actually have a 47% lower risk of death and also a 31% lower risk of having a heart attack than those people who only come one time.
Abby, so we're talking about patients that are prescribed a certain amount. Brian said 36 times to come in and exercise for their session. However, do you have some patients that might want to even continue longer because it makes them feel so good?
Yes, we do. We have a lot of patients that come in and let us know that they feel super great after exercise. In fact, some of them benefit so much that they get to decrease some of the doses of their medications or go off some of their medications completely, things like that.
That's great. So this really becomes like their new medicine instead of having to take all the prescriptions.
Exactly.
So Abby, you were talking earlier about how some patients actually want to continue the program even after their sessions are over. Tell me a little bit about that. It's called phase 3 or stage 3, right?
Yes, ma'am.
And tell me about that.
So we have what we call a phase 3 program, or our wellness program, that they can enter after their 36 sessions are complete. What that is more of a maintenance program, and they get to come in and exercise kind of on their own. So now that they have that knowledge from the 36 sessions, they have the opportunity to exercise and guide themselves, and they're kind of minimally monitored by us. There's definitely staff around, but it's minimally monitored.
So Brian, we were talking about this great facility and how they're monitoring the patients, but then they're also sort of self-guided, but there's always a great team around. Can you talk a little bit about the team here?
Well, heart and lung disease, like we mentioned before, require a holistic response. So we have a diverse team here to help out our patients. We have nurses and respiratory therapists, exercise physiologists, and dietitians. And so we all kind of approach the different diseases from different angles.
Well, it's a great facility, and we're so thankful for your time today. We really appreciate it.
Okay, nice talking to you.
Thank you. Nice talking.
Thank you.